It's important to know your blood type because if you are a mother or a mother-to-be and you're about to have a baby, depending on your blood type, if you have a negative, like an O negative, a B negative, and if your baby happens to have a positive, it's possible that your body can attack or fight your baby.
All right, so let me tell you a little fun fact here. More people know their zodiac signs than they do their own blood type. But which one do you really need to know in an emergency? Listen, if you don't know your blood type, you're not alone. Most folks don't bother to check their blood types unless they're donating blood or planning for a baby or find themselves in a life-threatening situation. But knowing your blood type can actually help save a life. More than 4.5 million Americans receive a blood transfusion every year. But aside from saving someone else's life, you could actually save your own life. There's several reasons why knowing your blood type is crucial to healthy living. So let's talk about it with a physician and a wellness coach today on Portia. Hello and welcome to the show. A recent study shows only 62% of Americans know their blood type. And while some folks do know their blood type, not everyone knows the true meaning of that letter that represents your blood or the positive and negative symbols attached to it. So we brought in some experts today to help and talk about it. Dr. Frita Fisher is a medical physician who's been a triple board certified in nephrology, internal medicine, and pediatrics. She says knowing your blood type is crucial to your health. Welcome back to the show, Dr. Frita.
Thank you. Glad to be here.
Yes, indeed. Always good to have your expertise here, and especially because you can cover so many interesting and really important topics that affect our health. Let's talk about why it's so important. I think it's just not even something anybody even really talks about, right?
Right. It's important to know your blood type because if, Lord forbid, you're ever in an accident and you need a blood transfusion or a loved one needs a blood transfusion, if you know that blood type, that can make the difference in the timing of getting that life-saving transfusion.
Right.
Also, if you are a mother or a mother-to-be and you're about to have a baby, depending on your blood type, if you have a negative, like an O negative, a B negative, and if your baby happens to have a positive, it's possible that your body can attack or fight your baby. And so it's important to know because there are treatments we have to prevent you from attacking your baby.
So give me an example there, because I don't think I've ever even heard anyone express it, like our bodies actually attacking the baby as a foreign, object. What happens when you don't know that that's the case? What can happen?
So it's called RH incompatibility. And I'll give you an example. My mother has an O negative blood type.
Okay.
That means that she will make antibodies to anyone who has a positive blood type.
Okay.
So when a mother is pregnant with her first baby, there really isn't any connection to the blood, but during childbirth, then the mother's blood is exposed to the baby's blood, and then the mother, if she has a negative type and she is in contact with her baby's positive blood type, she'll make antibodies. So then guess what? By the time she has baby number 2, that baby is in danger.
Right.
And you can attack that baby's blood and cause them to be anemic and have hemolysis, meaning their blood cells break and they can have jaundice, yellow all over, and it can even be life-threatening.
So I guess is that's your OBGYN, the pediatrician, like how are we testing for that?
Your OBGYN will test your blood type. So that's why it's really important to get prenatal care because your blood type will be tested, and if you have that negative blood type, so in my mother's case, O negative, then they'll make sure that you don't have antibodies. And if you do have antibodies, then there's a certain immunoglobulin you can be given to prevent you from attacking your baby.
Right, but this has to be a partnership, right? This
Absolutely.
is with your OBGYN, the prenatal care is so important for you and the baby. Let's talk about that delay that comes if you're in a critical healthcare situation and you can't say, or someone representing you can't say what your blood type is. How much of a delay are we talking in terms of the time it takes to get your blood type and then get a transfusion going?
So the blood typing can be done, especially once you get to the hospital. The good thing is that we do have a universal donor when it comes to blood. And that universal donor is the O negative. And that's because we have the 4 blood types.
That's ironic.
Yes. So the person who's O negative can only receive blood from someone who's O negative. But the person who's O negative can give blood to anyone. So
okay.
you're kind of in the catbird
Body is so
seat.
amazing. I mean, just such a, what God did with bodies is just incredible. But go
Yeah.
ahead. It's just interesting.
And on the flip side, if you have AB positive blood, you can receive blood from anybody, but you can only give blood to an AB positive.
AB positive. And so that's why it's so important to know. Do you think people spend enough time, like, is this conversation something that physicians are having with patients, or does the patient need to sort of, you know, be the informed patient and say, you know, by the time, while we're here, can we go ahead and get tested for my blood type just because I'm thinking about starting a family? Like, what does that conversation look like?
It's actually not a common conversation because
Yeah.
honestly, until you're in a major car accident or until you're having a baby, then the urgency is not there. But if you're informed and you know your blood type and say you have that negative blood type and the future father of your baby, if they have a positive blood type, well, then you know that it's possible that you could be in a position to reject your baby potentially.
Right.
And so knowing that can help you to kind of be cognizant when you're going into it.
But is it true, too, that there are also some, you know, maybe conditions, infections, illnesses that you may be a little more or less prone to depending on your blood type?
It's true. Certain illnesses, malaria, certain cancers, there's been a correlation, but we don't necessarily have a cause and effect. And so for someone, for example, if you have a blood type and you're not likely to get heart disease, I certainly wouldn't counsel a patient to go out and eat all the fatty foods and saturated fats.
Right.
You know, we would still have the same health counseling regardless.
Right. And are these things, you have a book. Is there something that you talk about as well in your book in terms of just why it's important for your overall understanding of your health and wellness?
I don't talk about the blood type. I talk about the blood pressure. And we know that's a number one killer, a leading cause of heart disease, strokes, kidney disease.
Yeah.
So I talk about blood pressure specifically in the book that I have, Under Pressure, A Guide to Controlling High Blood Pressure.
Understood. In this conversation, I want to make sure that people understand, because we're going to have some conversations about, you know, what you should eat for. But this is something that you talk about too, even in your podcast, right? This is something that we want people to be hyper aware of.
Yes.
So you're not finding out and trying to hustle and find out in an emergency.
Absolutely. And now they're actually at-home tests that people can take. Because if you go to your doctor and you ask for your blood type, unless you're about to have a blood transfusion, then insurance typically won't cover it.
Which can always be the barrier for getting work done.
That's it.
How you feel about these tests? I mean, I'm not asking you to rate them, but online, is the accuracy something that industry-wide is being evaluated as something that's it's good?
It can vary from test to test, so it's hard to make a huge statement about the accuracy. But I'll tell you anecdotally, in all of my personal experiences, the people who have done home tests, they've been accurate.
Okay.
They've been accurate.
So that's good. So no excuses, right? Let's
No
not let the
excuses.
lack of insurance stop us from getting the information we need, right?
Right.
All right, good deal. All right, coming up next, this conversation is really, really good, about to get even better. Next, you're going to meet AC. She is a wellness coach who is showing us the proper ways to eat for your blood types. And guess what? It's been a minute, so I wanted to figure out what my blood type was as well. So AC, just before the show, we did a blood test like Dr. Frita was talking about. I'm going to get my results after the break. Stay with us.